Welcome back. Now that you understand the difference between chronological and biological age, let's talk about one of the key drivers of biological aging, chronic inflammation, and how glycans are a key marker for it. 12 different hallmarks of aging have been identified, and amongst them is inflammaging. Inflammaging refers to the accumulation of low-grade chronic systemic inflammation in the body as we age. So why is chronic inflammation so dangerous? This is because it accelerates biological aging and is linked to diseases such as cardiovascular disease and neurodegenerative disorders. In fact, research shows that elevated inflammatory markers predict higher mortality risk. To sum up, inflammaging is a leading contributor to 3 out of 5 deaths worldwide. However, chronic inflammation is notoriously difficult to measure. Acute and chronic inflammation are very different, and most existing biomarkers capture acute inflammation, making it hard to get a clear picture of chronic inflammation in the body. We can compare this to driving whilst only looking at the rearview mirror. You're only able to see what has already happened. And this is where glycans come into play. Glycans are complex carbohydrate molecules attached to proteins in the body, and they reflect changes in immune function and chronic inflammation. Glycan profiling provides a stable and accurate measurement of chronic inflammation, capturing both pro-inflammatory and anti-inflammatory processes. People sometimes confuse glycans with glycation, which is a different process. Glycation is random and non-regulated, and it occurs when there's too much glucose in the blood, and this leads to proteins being damaged. This is measured through HbA1c, commonly used for glucose control in diabetic patients. However, glycan age measures glycosylation, which is a controlled, regulated, and enzymatic process that attaches glycans to proteins. About 60 to 70% of our proteins are glycosylated, and the type of glycans attached to these proteins give us insight into immune function. Our focus is on immunoglobulin G, also known as IgG, which is the most abundant antibody in the immune system. The glycans attached to IgG give us information about whether the immune system is in a pro-inflammatory or anti-inflammatory state. And in the next video, we'll show you how to use glycan age results to improve patient care in your practice.